Do people even get just regular sick anymore? That's been a meme question for the last year and change, but it is a serious question in the stats too. For example, I was browsing local news stories this week and look at this. Wow, Montana state health officials have confirmed the first case of the flu in the state in over a year. That's right, we're supposed to believe that in a state of over 1 million people, not one person got the flu during the entire 2021 season, and that near zero trend is supposedly true across the country as well. On average, something in the neighborhood of 50 million people a year get the flu nationwide. Last year, under 2,000. In other words, flu cases were down 99.99% last year, and we're supposed to believe that's because we're all just so good at masking. But also, the reason corona won't go away is because we're not good enough at masking. Seriously speaking, there may be some statistical reclassification in play, or perhaps it is all scientifically legit. There are theories that viral interference is in play, as in the prevalence of one virus prevents the transmission of the other. Either could be true or both simultaneously, but what is absolutely true is that yes, just getting plain old regular sick is certainly still a thing. It still happens, and the evidence suggests that our ill-advised health strategies have actually worsened it. Remember, the original idea behind shutting everything down in the first place was staying home to protect our healthcare resources from being overrun. And now, ironically, it appears that staying home has compromised our healthcare resources to the point that they are being overrun. So you can cross that line off the very short list of benefits we've received in this deal too. Reported this week by NPR, ERs are now swamped with seriously ill patients, but many don't even have COVID. And one of the first oddities about this story is its original headline, or the change made to it. It's actually a premise reported in the body of the article. During spring 2020, the original surge, many emergency rooms across the country were often eerily empty. Visits to emergency departments dropped to half their normal levels, according to one piece of research, and didn't recover until summer of this year. Right, so it was a pandemic so scary that people were too scared to go to the hospital itself. In other words, the fear was more pressing on people's minds than the virus was on their bodies. That is a major red flag for the narrative, and that's probably why this piece's original headline was changed. On publication, it read, "Once practically empty, ERs struggle with a surge of pent-up sickness," presumably realizing that calls into question why ERs were empty during a pandemic. The authors apparently made a stealth headline change, by the way. Nowhere is that edit noted in the story as it's posted now. Anyway, why is this happening? I thought we were staying home to benefit the health of everybody. Well, because just like every other aspect of our behavior over the last year and a half, you can't radically alter it and expect no consequences. The consequence of staying home in this case means staying away from hospitals and other healthcare facilities. It means not getting that usual checkup. It means not getting that strange ache or pain or growth checked out. And if you're not going to the doctor, you're probably not going to the gym either. So for many of us, it means adding weight to bodies that frankly weren't all that trim on average in the first place. We tried to flatten the curve. Instead, we fattened it. And all of these factors in combination add up to a population that is less healthy, not more healthy. As the story reports, it means people now showing up to the hospital are sicker than they were before, with diseases more advanced, in need of more complicated care, and with a host of issues needing treatment, including abdominal pain, respiratory problems, blood clots, heart conditions, and we didn't even mention the mental health consequences our decisions have had yet, but suicide attempts. These are all common reasons for now surging visits to the ER. It's a national trend, but this story focuses on a few specific examples. In the case of a New Orleans hospital, an ER doctor who's the president of the National Academy of Emergency Medicine says the conditions aren't even humane. She says during a recent shift, she heard a patient crying nearby and went to investigate. It was a partially paralyzed man who'd recently had surgery for colon cancer. He had a post-op wound that needed monitoring and maintenance for drainage, but he was unattended to. So fluid from that wound had leaked everywhere. His bed was covered. He was lying in a puddle of his own secretions. He was crying out of fear of infection, saying he'd been laying like this for 8 to 9 hours. The nurse in charge of his care simply hadn't had time to take care of him with so many critical patients under her watch. And again, these are just people who are regular sick, not people gasping their last corona breaths. And of course, patient acuity, the severity of their conditions, is only one contributing factor here. Even if patients are sicker, it's not necessarily a huge problem if we have the people and the resources to treat them. But the trouble is, again, because of our own poor decision making, oftentimes we don't have that either. According to that same New Orleans doctor, it's not just an issue of the volume or the sickness of these patients. It's also an issue of nurse to patient and doctor to patient ratios, as in how many people you have to treat the sick. The piece also highlights an ER nursing director in Lansing, Michigan, a woman who says she dreads opening her email inbox each day because she fears she'll find another nurse's resignation. The story says they're leaving to take higher paying jobs as travel nurses, or to go to a less stressful type of nursing, or simply to walk away from the profession entirely. Mentioned nowhere in this story, though, is why these nurses might be walking away from the profession entirely, or more accurately, why they might be forced away from the profession entirely. Because I notice how this mass exodus the nursing director is observing very closely corresponds to the health system informing its employees it's vaccine mandate time. But I'm sure that's just a coincidence, though. This can't be just like the mandate at another major Michigan hospital system that produced a similar staff shortage crisis. 400 healthcare workers from the second largest hospital network in the state gone overnight at the start of the month, expressly over the mandate. And so the hospitals scramble to hire replacements, and of course, those replacements are at a lower level of preparedness and experience. This particular hospital system has now waived its prior requirement for working in the ER. Before, you had to have at least 1 year of nursing experience elsewhere. Now, they're just bringing in ER nurses straight out of nursing school. And many of those nurses need help with learning even the basic tasks of the job. So now you're getting less competent care for your health, but don't worry, because it's for the preservation and advancement of your health. And that's if you get the care that you're looking for. They've had to fire so many people that you may not get that care at all, or at least not quickly or in less than ideal conditions. The story describes a guy getting a physical in embarrassing public view in the ER lobby because there were no rooms available. Just like the police and emergency responders in New York City and Chicago and elsewhere, where city leaders are forcing their emergency personnel off the job, the reasoning here suggests it'd be better to have nobody available at the hospital to treat you when you arrive than it would be to risk contact with an unvaccinated person. Even if you do think that the virus is risky, there is no rational way in which that is a sensible calculation. If you're in condition critical enough for an ER visit, lack of attention implicitly means death. If you're bleeding out, getting your wounds wrapped up with gauze saturated in bat juice from Wuhan is still better than no wrap at all. There is no circumstance in which not having people to staff hospitals is saving lives. That is only costing them. And there's data to show this. I've referenced it before, but I do it again because I want to make sure that everyone is aware of it and understands it. Forcing people home has not saved lives. Reducing our capacity to treat people and forcing healthcare workers off the job has not saved lives. For all the insistence that our strategies are life-saving, where is the data to show that? In the spring, the Journal of the American Medical Association published CDC data on 2020 deaths by cause. Even if you accept coronavirus as a major killer of last year, common causes of death were also drastically increased in 2020. Heart disease, up 30,000 deaths, 5%. Unintentional injuries, including drug overdoses, up 20,000 deaths, 11%. Strokes, up 9,000 deaths, 6%. Alzheimer's, up 12,000 deaths, 10%. Diabetes, up 14,000 deaths, 16%. And don't trust me to tell you that's because of exactly what today's story describes. People not seeking care and a lack of healthcare professionals to see them if they do. Instead, trust the experts at the Journal of the American Medical Association. Quote, "These increases in death may reflect disruptions in healthcare that hampered early detection and disease management. In likely hundreds of thousands of cases over the last year and a half, we have quite literally scared people to death. We have propagandized people into taking worse care of themselves and not seeking the care of others when they need it. And all the while, we've propagandized ourselves into believing that we're the good guys who are saving lives. But who are we saving? And who have we saved? There is no evidence anywhere to show that these totalitarian interventions have produced obviously better health outcomes than simply respecting free people to make decisions for themselves would have. If there is data to show that there's some totalitopia out there that has successfully crushed the virus with an iron fist, send it to me. I will look at it just as honestly as all the other data that says otherwise. But let's say that evidence does exist. Even then, we still aren't in the moral clear. Even if we do grant the premise that we have saved some lives, how do we justify that trade when we know that the measures we've taken have cost thousands of other lives in exchange? How do we justify assigning ourselves the moral arbiters of what lives are worth living and what lives aren't? In this context, how do we justify terminating the nurse who wants to treat people and scaring away the patient who is seeking her treatment, other than to say that we know better than both of them and are entitled to control of both of their lives for their own damn good? The best lesson of the last year and a half is that nobody knows better about your life and how to preserve it and advance it than you do, for reasons both practical and moral. Even if other people have good intentions, they can't possibly know every relevant detail about your history or your potential. And even if they could, that thirst for control is not the mark of a good person looking out for you anyway. Once everyone obeys me, there will be truth, justice, and prosperity in this world. That's not the script for your health. That's not the script for your success. That's not even the script for your survival. That is just the script of every diabolical villain ever written. Thanks as always for listening and for supporting this channel. Always appreciate that thoughtful discussion down below, and especially over on Minds. That is at ML Christiansen. You're always welcome to coming out and chat in my live streams. Those are linked down in the description. Looking forward to it. Goodbye.